Let's take a look now at how the COVID-19 vaccine rollout is faring in the Eastern Cape. I'm joined now by Mr. Maruping Lekwene, the Northern Cape rather, Mr. Maruping Lekwene, the MEC for Health in the Northern Cape. Good to have you with us this afternoon, MEC. Perhaps let's start off with the number of vaccines that you received in your province.
No, thank you very much, Tammy. As Northern Cape Province, we have received 3,902 vaccines, just below 4,000 last week, Wednesday. And I can report to you that since from last week, we have now vaccinated a number of 1,176, both from the private and public staff, from the private 414 and from the public 762. So we're doing pretty well so far.
This is, I do acknowledge, just the first phase of the vaccination process. What is the targeted number that you aim to vaccinate this time round, considering that in total you have about 14,000 healthcare workers who have to be part of the vaccination process?
Our target for now, with the doses we have received from national, we have received 3,902 vaccines. So we're hoping within 2 weeks to have finished all our vaccines, which we will be using Robert Mangal Sobukwe Hospital as our primary site. So within 2 weeks, we would have finished just less than 4,000 vaccines.
4,000 vaccines, and how many healthcare workers who would be vaccinated?
Of course, 4,000 for now. You must understand that from the 80,000 which the country received, they were distributed proportionally. Northern Cape received 4,000 only. So the target is that within just 2 weeks, we should have vaccinated or used all the vaccines on our healthcare workers in the province. And I think so far we are on track. We're just increasing our numbers in terms of our daily cases of vaccination.
I mean, the Northern Cape also has quite a lot of rural areas, and accessibility on road does at times tend to be a problem. What kind of measures have you put in place to ensure that healthcare workers in the far-flung areas also get vaccinated?
We have 5 districts in the province, and we have targeted all our major hospitals and our central CHCs, which will be used as a vaccination points. So we have a clear program in plan. A clear program which is clearly outlined. We will be using our entire resources, both our private and our public healthcare services will be inoculated. We have our transport plan clearly outlined, but also there are central points where all the workers will be assembling to receive their vaccine. So every district, in terms of its own peculiarities, there is a proper plan on how to roll out the vaccine in the Northern Cape Province.
Of the 1,176 so far, how many of those are in the more rural areas?
For now, given the limited number of vaccines we have received, we're just targeting the Kimberley area, which is the most densely populated area in the entire province. So we're hoping to finish the entire 4,000 vaccines in the Kimberley district or area. And as we receive more vaccines now, we'll be going to Upington, which is the second biggest, which is Springbok, and going to Kuruman. And in those areas, then we'll then be branching off to all our rural areas where there's a clear plan on pending also on how many vaccines we receive as well. And the more we receive, then the more will be then targeting all our healthcare workers in the province.
So your strategy then, as the Northern Cape, is more geographically located than anything else. That seems to be your primary consideration of who gets the vaccine.
Absolutely. It's in fact district based. Every district, as I've said before, is having its own peculiarities, and will be then targeting all districts. The first point is the Namakwa district, which of course will be using Springbok as a center. to try and vaccinate the most people because it's a center in that area. But in all other far-flung areas, we'll be using our CHCs. We are also waiting on the appropriate refrigerators for the vaccine, which currently we're only having them here in Kimberley. But within sometime next week, we'll be receiving new refrigerators, which will be able to keep the vaccine in the required minus 20 degrees Celsius, which then we'll be using them in all the districts to ensure that we don't waste any dose or any vaccine in the province. So we do have a program in place which will ensure that which will respond to our needs and demands as per our province in the Northern Cape province.
You also have categories that you've put in place to classify the different healthcare workers. Talk to us about those various categories and where they fall within your vaccination structure as far as prioritization is concerned.
Absolutely. Our key prioritization is what we define as the patient-facing staff, which will be your nurses, your medical officers, and your health allied workers in all different fields. But of course, we're also focusing on our core component in terms of your porters, your cleaners, your clerks. So the focus for now is to really vaccinate as many as possible in terms of our frontline staff, your doctors and nurses. And then after that, we'll be branching off now to the second phase and third phase as planned by the entire country. But for now, we are really focusing on our healthcare staff, which is your nurses and even the doctors. And we are focusing also in the public sector largely, not also excluding your private sector, which is also part of the plan as well in the province.
And let me see, what have been the sentiments from healthcare workers regarding the inoculations? Have many of them actually already registered on the portal? Are they quite open to receiving the vaccine?
Yes, for now, in terms of those registered in the portal, it's 1,995, which is a good number. But the only problem which we need to focus on in the province is the shifts, because some of them are working night shifts and some of them will need transport. Just yesterday, we engaged with all organized labor in the department with their reps in trying to further even reinforce and strengthen our program. So the response is very positive. Most workers do want to take the vaccine. They know that is the correct thing to do in saving lives, but also ensure that even themselves, they are safe first and foremost. And then from there, they can then ensure that they really take care of our population in the province.
So does it mean, MEC, that if a healthcare worker has not registered on the portal, that they will not be inoculated? Or can they still receive the vaccine even though they have not registered? Because I'm looking at the number of people who actually have registered. That's quite minuscule. It's 1,175, and you've got 14,000 healthcare workers who have to go through this process.
Yes, I said the ones who are on we have received the vouchers from the Sisonke system for vaccination is 1,995, just below 2,000, meaning that there are more people who need to be vaccinated. As I'm speaking to you, our program is going pretty well. People are coming in, but we're also working on Saturday as well. We're hoping that within the 2 weeks, we would have covered, just for the first week, we've covered almost 50%. From the 17th up to now, we have covered 59% of our target, which is not bad. Within the next week, I think we would have covered the outstanding numbers. And I think even the unions also, they also helping us with the communication strategy to call upon their members to really avail themselves for the inoculation. So I don't foresee any problems in the province. Within 2 weeks, we would have reached our target of just below 4,000 vaccinations.
Well, thank you so much, MEC, for the update there in the Northern Cape. That's MEC Maruping Lekwene, MEC for Health in the Northern Cape, updating us on the inoculation process that's currently underway there.